Hello and welcome to another episode of Gender Stories. I know I always say I'm excited, but I am. I'm always so excited and so thrilled about my guests. I just have the best guests. What can I say? Sorry, other podcasts. So today I'm really excited and thrilled to welcome Alex Papale, who's a physiotherapist, a doctor in physiotherapy. I think it's DPT. That's what it stands for, right? And is a pelvic health physical therapist, consultant, sex educator, and international speaker based in Boston, Massachusetts. They specialize in queer and trans health and treating patients of all genders at Flourish Physical Therapy. Alex especially loves to help patients with pelvic pain, difficulties around sex, peripartum care, pelvic floor support with HRT, orthopedic support for pain related to chest banding or genital tucking, and healing from gender affirming surgeries. When they're not in the treatment room, you can find them writing and teaching gender affirming, sex positive, kink-informed courses for current and future healthcare providers, or for anyone who wants to learn more about sexuality, their bodies, and pelvic health. Alex has also created the course Physical Therapy Care of Trans and Gender Diverse Patients, Multi-Day Con Ed for pelvic health providers. And I had the absolute pleasure of actually seeing Alex speak at the Spring ASEC Trans Thriving, I think we call it, Virtual Training Institute. And you were fantastic. So I am so glad that you made time for this interview. Thank you so much for being here with us today.
Thank you so much for having me. That really means the world.
It was so great. I feel like I learned so much, and I've been in the field like a hot minute, but I truly feel like I've learned quite a few things. So I'm so excited to get to share this with Gender Stories listeners. So let's start maybe from even describing what pelvic health is. A lot of people don't know about the field of pelvic health, and they don't know that there is a whole field of physiotherapy that is called pelvic physiotherapy. Like I didn't know before I became a sex therapist. I don't know, 20 years ago, whenever it was. The general public usually is not necessarily like aware of this field. So how would you describe the field?
How would I describe the field? I think that it sounds like very like specific of like we're working
Mm-hmm.
primarily with your pelvis. And I like to start with first and foremost our pelvis, I would argue, is one of the more central points of our body. So a lot of different things are interacting with our pelvises and our pelvic floors. So for me, I graduated PT school. I was kind of a generalist or like an orthopedic physical therapist. And then I went on to take further continuing ed to specialize in pelvic health. And so all pelvic health providers can do that kind of basic, like the orthopedic, I say basic lovingly, very important, orthopedic physical therapy. So more like elbows, shoulders, knees, stuff like that. And then also like so pelvic PTs can do that, and then orthopedic PTs would like need to kind of do that continued ed there. And so it's not far removed from the world of physical therapy, but pelvic health particularly is focusing on bowel function, bladder function, sexual function, and then anything related to pain. So that can include, for instance, in like the bowel realm, if somebody has honestly, like the TLDR is that like everyone should go to pelvic PT at some point in their lives.
Absolutely.
But bowel wise, like thinking like constipation or issues with like urgency, like 0 to 100, or issues with incontinence, that also goes for urinary function. If anybody has anything funky going on, if there's any pain when they're urinating, if there's like if somebody has interstitial cystitis or painful bladder syndrome, that's something that I work with folks on a lot. Any realm of leakage. So even if you're like, oh, well, it's like not a huge deal that I leak a little bit of urine every time I like cough, sneeze, laugh, or lift something or anything in that realm, like there's definitely stuff that we can do about it. In the realm of sexual function, so if anybody has pain or difficulty with anything penetrative, and that can be anywhere. I think oftentimes it gets the rep of like just being for folks with vulvas, but that's definitely not true. If folks have erectile issues, that's definitely something that pelvic PT can be useful for. If somebody has painful periods, That's something that pelvic PT can be useful for. If somebody has endometriosis, this is something that often gets recommended and is very supportive.
Mm-hmm.
Um, if somebody has just like low back pain that is not getting better and they've tried,
Mm-hmm.
you don't have to try everything else first, but oftentimes I've seen folks who have tried a lot of other stuff first, and it turns out it might be more of their pelvic floor muscles impacting their low back. Same with their bellies as well. I'm oftentimes treating someone's like back, shoulders, bellies, like hips, knees. It's not all just pelvic floor focused, and our everybody has a pelvic floor also, and
Mm-hmm.
so it's like a bowl of muscles that kind of sit at the bottom of our pelvises, and they're really responsible for support for anything kind of coming in and out of our bodies in that area, including, as it says, a big role in like lymph drainage, things like that.
Mm-hmm.
There's a lot going on pelvic floor wise,
Yeah.
and so yeah, I really will die on the hill of everyone should go to pelvic PT at some point in time. I do just think it can be a total game changer.
It really is a game changer. I have gone to pelvic PT and I will likely go again at some point. I do have interstitial cystitis, and I think a lot of people, I'm so glad that you mentioned like everybody has a pelvic floor. I think there is this misconception that often pelvic health is seen as part of women's health. And in fact, in some clinics, it might even be under the women's health clinic umbrella. And I know that's been really impactful on any kind of masculine folks, trans or cis, that I've tried to send to kind of a pelvic PT because, if they're under women's health, I even had clients like being turned away because they look the wrong gender, whatever that means, right? In air quotes.
Mm-hmm.
And so it can then that it's already so hard, I think, for people to go to pelvic PT because it feels so vulnerable, right? And there can be a lot of anxiety. And then if there is this other barrier where people, maybe somebody in the front office is like, oh, you look like you're in the wrong place, right? Because this is seen as part of women's health. It can even put people off even more. So I don't know if you want to say anything about that experience of traditionally it feels like it was under their realm and now it's like, most places are doing it separately from women's health, but not everywhere in my experience, at least where I am.
Yep, I totally agree. I think that the field is coming along slowly but surely. It's even better than when I first started practicing, which
Mm-hmm.
was in 2018. It's definitely come a bit. I mean, the American Physical Therapy Association, which is kind
Mm-hmm.
of like the big PT association, is they had in the last several years, I forget which year, I want to say maybe post 2020, they had changed their section on women's health to be called the
Mm-hmm.
Academy of Pelvic Health instead,
That's
which
right. Mm-hmm.
was a big move, which did not actually have like the full agreement of the section, which I thought was pretty. That makes a lot of sense. I think even though I think that pelvic health and pelvic health care is pretty radical, or it
Mm-hmm.
tends to be. It's not. That's not always true. That's not everybody's thought. But I also just thought it was doing a disservice to women as well. Of like,
Yes.
that's more like women are more than just their vulvas and vaginas and pelvic floors. Like there's actually far more that goes into like really truly being like holistically supporting women, and that includes like all women, not
Mm-hmm.
just the cisgender women or women with
Yeah.
vulvas. And so I think yeah, I'm so happy to see the shift, but I definitely see that it has a long way to go. And I still do see that I'm always looking if I'm referring people in different states or things like that, as I'm looking up like other pelvic health providers. I'm like, what is your language around what you
Yeah.
treat, like who you see? You can always kind of pick it up pretty quickly. And that's definitely like a note. It gives me pause, but I do have hope that it's coming along.
I agree. I think it is coming along, and I definitely have seen like my referral network get broader and broader, right? And of course, then we have to deal with insurance, which is where sometimes then people run into issues because they're like, I know you've suggested this person, but my primary care provider and my insurance say I can only see this person in my referral network. And I'm like, well, you can try. I have no idea, or I do know that they're under the women's health umbrella. So be prepared, for maybe a different experience when you arrive and check in, right? Because we know that when we try
Mm-hmm.
to access healthcare, it's the whole experience. It's not just seeing the provider, it's also the front office staff, and the even just where the clinic is located in terms of, is it under like a women's health or OBGYN umbrella or whatever it's going on in the hospital or the clinic that is hosted in. So many things to consider. Yes, I feel like that could be its own conversation, but
I
I
know.
love, right? Like, and maybe we'll circle back to it, but I want to stay with why it's so important to take care of our pelvic health. I know as a trauma therapist and a sex therapist and also somatic experiencing practitioner, I know there's a lot of connection, for example, so between pelvis and jaw, like, right, that often like, people with TMJ, or if you have really tight kind of jaws, that can really be connected to your pelvis as well. And I know when I do kind of work on sexual trauma somatically, often like anything to do with the pelvic area can be super activating. Even sitting on one of those big bouncy gym balls and just like gently like moving around, right? That can be very activating for folks, which is part of the healing work that can be done. So you've done such an amazing job of saying why somebody might come in to see a pelvic physiotherapist, what the issues might be to begin with, but how can seeing a pelvic physiotherapist improve somebody's overall health, I think, not just the issue that come in to see you for.
Yes. So another misconception that comes up with pelvic health that I feel like is very tied to this is that we are only focusing on the pelvic floor during a pelvic health session. And I am spending a lot of time working with somebody on their breathing, for instance. There's a lot that we do that has actually like nothing to do like proximity wise. I don't want to
Yeah.
say that like that. Like that's not directly pelvic floor. And
Mm-hmm.
so I'm oftentimes working with like, yeah, how can we like change the way that your body is responding to your breath? Like where can we get a little bit more space? Where can we get a little bit less tension? And
Mm-hmm.
so that is also very closely tied to our nervous systems. And
Yep.
a big part of what I do is helping people wherever they might be at in this journey. There's no cookie cutter, at least definitely not in my
Mm-hmm.
practice, but where they can be to try to tune into what their body is telling them at any point in time. One of the big things is like we're really like learning how to listen to our bodies. And so I think that that is a huge kind of way in which pelvic PT can really be a game changer for someone's experience of just like of life. I think
Mm-hmm.
that oftentimes people are under the impression that if something is going awry pelvic floor wise, that it's because of a singular event that happened, or like they gave birth, or there
Yeah.
was an accident, or there was trauma, or something happened. The most responsive part of our body to stress is our pelvic floors.
Yeah.
And we have a pretty limited amount of brain space dedicated to our pelvic floors. If you think about like doing a pelvic floor contraction or like a Kegel, you're trying to like pull your pelvic floor muscles up and in. You're doing kind of all of those muscles are moving at the same time, even though you have many individual muscles that make up your pelvic floor. You can't isolate just one of them or just one side. It all kind of goes together. And when people hear that like decreased kind of brain space for our pelvises, that doesn't mean that there's less nerve endings. We know that there's a
Mm-hmm.
lot of nerve endings in our
Yeah.
pelvic floors, but it's different than the space that is allotted for our faces or our hands, where we have like all these fine motor movements or like micro expressions.
Mm-hmm.
Like we can't do that with our pelvic floors. So thinking about that very sensitive part of our body to stress that we also it's harder to feel and it's harder to engage with when we're experiencing a lot of stress. It kind of tends to build in our pelvic floors, and so then sometimes it does feel like it's like this one event that happens and all of a sudden everything is gone awry. But it tends to be like a bit of a buildup over time that can be really challenging to tune into. And so we're working on how to like feel the stress in our bodies, like what kinds of signs we are getting from our bodies or our nervous systems that things are getting a little bit funky, like what those sensations can be like. And another big part about pelvic PT is that we don't actually need to be working directly on the pelvic floor for folks to see a difference and for folks to like see improvements. And so we're oftentimes working like what you were saying. I'm always asking people if they have any like anything interesting going on jaw wise, any like
Yeah.
headaches, things like that. If their like lower legs are bothering them, and like their feet are bothering them, that can be also very related pelvic floor wise. Everything's connected.
Yeah.
And so I'm working kind of like with more of the whole body situation. So it definitely helps like all of the above, and changing those like breathing mechanics like makes a big difference if someone wants to start a new like movement routine, like figuring out like when to breathe, when to like support yourself with your breath versus getting a little bit more movement with your breath. Like all those things make a big difference.
Absolutely. I remember going to a pelvic PT for the first time and coming home and going, I don't know how to breathe. How did I manage to go through like 40 plus years of life and I didn't know how to breathe, right? And they're like, what do you mean? I was like, let me tell you, this is like blowing my mind, and I was like, I'm not breathing right. And then this is how, it's impacting everything else. We are kind of just like this whole system, right? That it's all connected. And I think that with Western medicine, we treat our bodies as if we could dissect them in some ways. And
Mm,
sometimes we even treat our mental health that way, right? Like, specialize on depression or anxiety or trauma. And people specialize, like, I need to see like different orthopedic specialists for like my spine and my hips and my knees. But it's like my whole body, right? Like having a connective tissue disorder, it's everywhere and it's impacting every part. And I'm like, yeah.
mm-hmm.
And so pelvic PT can make a huge difference. Absolutely. And I think that it touches also on the anxiety sometimes people have going to pelvic PTs. Like, I'm not ready for somebody to like touch me in my pelvic area, or that could be really triggering if anybody has any sexual trauma or sexual abuse even from
Mm-hmm.
childhood. And so how do you approach kind of pelvic PT from like a trauma informed in a trauma informed way, and also kind of maybe reassuring people that you don't even have necessarily to like drop your pants for your pelvic PT person, because I think people have a lot of anxiety around that. Does that make sense? Sorry, I'm just so
Yes.
direct sometimes, but you know what I mean.
No, I know exactly what you're talking about. I know exactly what you're talking about. Um, yeah, so when I see somebody for the first time, when they're first coming in for our intake
Mhm,
session, I will always ask them like what they know about pelvic PT, like what they've heard
mhm,
of. By and large, even I work in a private practice, and so
mhm.
it takes like a little bit of extra work and thought, I think, to come in than if someone is going
Yeah.
through insurance. And so even then, like I still find that most of the patients who come in are like, I don't know, someone told me to come in, or I've tried everything else, or I don't know what else to do, or TikTok told me to do this.
Yes.
And and I then will describe kind of like what the options are for our session. And so the most important part to me is the patient story,
Mhm.
and it's what their experiences have been, what things feel like in their bodies. There's no right or wrong way to describe something. If I am often hearing like this might sound really weird, but and then they say something that like totally makes perfect sense that I've actually heard several
Mhm.
times. Like I think that it can feel really isolating to have any of the issues that I've described. They're things that no one ever wants to talk about. Like you never want to
Yeah.
talk about having like urinary incontinence when you laugh, or like pain with penetrative sex. Like those are hard things to just like bring up with even a partner or someone that you really know well
Mhm.
versus like a medical provider who you don't know. It's challenging. There's a lot of stigma attached to it. And so I like to kind of just right from the go, there's nothing that's required in this session. We can spend the whole time just talking, and I can send you home with things to start with. We do not need to, yeah, this is what a pelvic health assessment, like a pelvic
Yeah.
floor assessment looks like. It's different than a gyne assessment.
Mhm.
And there's layers of like how kind of significant we want to be like going into that direction today. We can go externally over clothes. We can go all the way to doing like an internal assessment as well.
Mhm.
but none of it is required. And that also doesn't mean that we have to do it next time.
Mm-hmm.
It's really whatever. I try to make it very clear with folks that it is really a choose your own adventure of here are our options. This is the layout. These are some things that we can look at. We can do the subjective intake today of just like hearing someone's story. And then maybe
Mm-hmm.
we do an orthopedic assessment. Let's look at posture. Let's look at maybe you sit at a desk. What's that setup? Can
Yeah.
we edit some things there? Maybe like let's look at how you're bending down to pick something up and see
Yeah.
if we can kind of make some edits. There's a lot of places we can start. And I've had a lot of success with folks who have pretty significant pelvic floor issues that we've actually never
Mm-hmm.
worked directly pelvic floor wise. There's
Mm-hmm.
so much that you can do and it's so connected. It really kind of depends on, yeah, what someone's up for, where someone's at. I think a good amount of people are in the boat of like, okay, great, that's so good to hear because I didn't actually feel like I was really up for that,
Exactly.
but I was gonna like push myself through that. And I'm like, nope, we are not doing that. This is not a no pain, no gain situation, nor will it ever be. So we're taking our time here.
I think that is so important for listeners to hear because I think so many people are so used to going to a medical provider and be like, I'll just do whatever you tell me, right? And even when I prepare therapy clients to go see a pelvic PT, I say, especially if there is significant sexual trauma or trauma in that area, I'm like, you can say, I do not want a physical visit the first time. And if they insist, we'll find you a different pelvic PT and I will
Yeah.
fight with your insurance if we need to. I will be like, I know that this is the only pelvic PT you cover. And this is what happened when my client went. And this is why we're asking for you to cover like a different service, right? Like a
Yeah.
different provider. Because I think it's so important. People are so used to we're also used to overriding our own nervous system. I know as a disabled person, there's plenty of time where I'm like, I am just going to override my own nervous system to survive the specialist visit or this exam, and we put up with
Mm-hmm.
things that, quite frankly, we don't need to put up with. We can have more boundaries with our providers and say, this is not what I'm ready for today. Mm-hmm.
Yeah, yeah, and I think about that a lot, especially with like the financial component, since
Yes.
so much in pelvic health is out of network or like
Mm-hmm.
not taking insurance, that there can feel like there's a lot of pressure where someone's like
Yeah.
paying out of pocket like a good amount of money to come to see me, and that sometimes they're like, well, I have to do all of the things.
Yeah.
And like actually, like I try to also tell them that like it's not great practice for your nervous
Yeah.
system, and we're doing a lot of nervous system work here, and also that if I'm trying to actually get an accurate assessment of someone's pelvic floor, if they're experiencing like a lot of stress and pain, I'm not
Yeah.
going to get an accurate reading of what's going on. And so that also tends to help a little bit of like, okay, you're not just doing this like for you and your nervous system, it's also like not going to give me accurate information. And we can kind of work on the like nervous system component as we're going. But but yeah, I feel like it's really important to just like give everyone gets the options. I show people their anatomy of their pelvic floor with
Mm-hmm.
like a ton of different visuals. I have a little model. I have some
Mm-hmm.
like printouts. I've got some pictures, and I'm gonna show them like exactly what I'm gonna do pelvic floor assessment wise. And so that they have a general sense. Like before I'm doing
Mm-hmm.
it, we kind of set the rules of like I will only move after I tell you what I'm going to do and you tell me it's okay. This is like how this will start. This is like what you can kind of expect sensation wise. Like I'm going to check in this amount, all that kind of stuff.
Absolutely. I often think how simple it can be for a lot of providers to be more trauma informed. And I have conversations sometimes with providers. I'm like, well, the main thing is just tell people what you're about to do before you do it. Not
Mm-hmm.
after, not like, not during, like say, this is what I'm going to do next, and just even one breath so that the person can be like, hang on a minute, or ask, do you have any questions? Like, it doesn't have to be super complicated. And so, let's circle back to what we are saying also about like gender and access, right? How it can make it, so one layer that can make it difficult for people to add pelvic PT to their healthcare kind of set is, this fear that they're not ready to kind of have a physical exam or anything like that. And that's not necessary, like you said. But another layer is that it has been so gendered for cis women historically. And so even the language sometimes, or the assumptions. And I have to say that sometimes even trans-friendly providers have made some missteps, I should say cisgender trans-friendly providers, not trans folks themselves, if that makes sense. I've had providers who, like, in their eagerness, for example, of being trans affirming, when I've seen them, like, have like made assumptions about whether I have genital dysphoria or not, or said, like, this must be really unpleasant. I was like, actually, you don't know what this experience is for me. I mean, yes, it is. And now it's even more unpleasant because you said that, while trying to affirm me, right? And so it's so complicated because I don't know, about you, but for me, I know when I have to see a lot of healthcare providers because of aging with Ehlers-Danlos syndrome. And often I have to be like, okay, I have to see the provider already. That's a lot. And then I have to think, oh, how are they going to interact with my gender? What language are they going to use? Are they going to, and not just misgender me, but like, what language are they going to use for my body? What language are they going to use in their notes, right? What assumptions are they going to make about my body? Whether they are trans affirming or not, actually, because like I said, sometimes people can be overly eager to be trans affirming and in their eagerness really miss the person in front of them. So yeah, does that make sense? Any reflections on
Yes.
that, or like, yes, what's your experience with that?
Yes, that it makes a ton of sense, and it is something I think a lot about.
Mm-hmm.
In my experience, especially talking about the pelvic floor, I think that a lot of people, including cis women, don't have a
Mm-hmm.
great sense of what words to use when. And
Yes.
so we're starting with a lot of education about like what body parts we're talking about in the first place. And when you add the like a trans experience on top of that, I like to just offer it as like, okay, like I think this would be really helpful to kind of just go through like the anatomy that you're describing, and I want to like show you like a visual. And so I try to have like unlabeled visuals if I can, so it's kind of taking out that part where it's like this gendered
Nice.
language.
Mm-hmm.
And if I'm asking folks like what they use, like what words they like to use to kind of describe their bodies, a lot of times people, as like, and I'm thinking like trans folks in this instance when I'm talking to them about this,
Mm-hmm.
that they're like, wow, I have not actually been asked that before by a provider. I'm not totally sure. Um,
Mm-hmm.
and I can offer like, okay, we can use like the medical terms that do tend to have
Mm-hmm.
like the more gendered language, but I do
Yeah.
like to just try to opt to use more descriptive gender neutral language, so more about what something looks like or its function. So for instance, the word vagina can be pretty loaded for folks,
Yep.
and so if that feels like, unless someone is explicitly like totally fine, you can use medical language, like it's all good, then I will opt for like, okay, and I'll tell them like what I'm referring to and look at the model and I'm like, okay, front
Mm-hmm.
opening, back opening, that's our
Very
language there.
simple, right?
Right. Or
Mm-hmm.
like if I'm referring to someone's penis or someone's clitoris, erectile tissue, gender neutral, but I know exactly what we're talking about here.
Mm-hmm.
Sometimes we can fall kind of into, I think, well-meaning providers can ask, so like, okay, we'll use the language that you use, but a lot of
Mm-hmm.
times folks aren't using language that a provider would then know what they're talking about necessarily.
Like, how many times do we talk about our junk with anybody who's not like a sexual partner or lover, right? Not that many.
Right, right,
Usually in my
right.
experience. I mean, I guess as a sex therapist, I do talk about it more often than most people. But you just generally outside of work, not a lot of conversations that we have about our genitals, right? Or like,
Yeah,
yes, or
yeah,
even like the colloquial term I use, right? Our junk, just because it seems like
yeah.
so like down to earth, but it's hard, right? And when providers have asked me that, I was like, well, not language I want to use in a medical visit, for example.
Right,
Yeah.
right. Or
Hmm.
sometimes, yeah, if someone was like, I truly only refer to my genitals as my junk or my bits or whatever, it
Yeah,
was like, well, that's not telling me anything about like what
exactly.
you're exactly referring to. Or for instance, if somebody has labia, then it's like, okay,
Yeah,
we're going like outer folds, inner folds. Even then,
yeah.
I'm using like outer and inner labia, period, because I think the labia majora and minora, like that, that can be tricky because a lot of people have like larger inner labia than outer labia and
Yeah.
stuff like that. So I like to use the terms that are more descriptive, and then once somebody is more familiar with them, then we can build off of that. But yeah, I think it's really important to just give someone the option of like what they want to hear, how you're referring to their body.
Absolutely. And I think that your solutions are so elegant, right? Erectile tissue, front opening, back opening, that is so immediately understandable to me. And yeah, it doesn't have that loadedness. Because I think also when we talk about our genitals, it's so loaded on a sociocultural level. I think that people have a lot of shame. I think that genitals are often weaponized in a lot of different ways, whether it's weaponizing size of genitals, whether it's weaponizing smell of genitals, and like,
Mm,
right. And so people also just like, even just somebody who doesn't have necessarily any sexual trauma, often I think there's just some feelings right there that we have because there's so much shame, I guess, and then
absolutely.
that shame gets weaponized in like different ways in the dominant culture. And so I don't know if you find that with clients, and especially with like trans clients, like trans non-binary gender expansive clients, but really with everybody, how do you manage to support the clients through that kind of shame or that even misinformation that they might have about how their genitals or their pelvic area works?
That that's a great question. I also wanted to say
Mm-hmm.
regarding the language or having more gender neutral language, definitely want to shout out Lucy Fielding
Oh,
and
absolutely.
yeah, and Heather Edwards as well as another like really wonderful like sex educator, pelvic
Yes.
PT who like kind of helped like hone in on that terminology a lot more. And so when folks like do bring up like stuff that feels like a little bit more shamey, like for instance, one of the first things I thought of is just the amount of time, and this honestly happens a lot more when I see like cisgender heterosexual women
Mm-hmm.
than queer and trans folks. But like as an example, um, apologizing for not shaving ahead of time.
Ah, yeah, that
That's
makes me
like
so
a
sad.
I
Yeah.
know, and that's a big one. And I don't want to add to that by being like, oh my god, like, or I try to just like answer in a more like neutral, like that's I hear you, and I also want to like add in like it's totally okay. I don't want you to ever feel like you need to do
Mm-hmm.
any realm of preparation before our sessions like that. And also, like hair is actually really useful here, and like here's all the reasons why. Sometimes that can just like give a little nugget of education there to just like normalize it a
Mm-hmm.
little more of like everybody's got hair here, and like this is
Yeah.
why this can be useful. And also like feel free to. I never want to also then like shame somebody for the fact that they
Yeah.
shave or anything like that. It's like you do what you want to do with your body, but I don't want you to ever do it on my behalf.
Exactly.
Um,
Mm-hmm.
yeah, yeah, and like the shame components can be can be challenging, and I like to also depending on where where someone's at, I get a little curious of like, oh, like where'd you learn that, or like where'd you hear that from? Especially if it's sort of a like, oh, like I'm sorry if like my pelvic area like smells or something like that. Like,
Yeah.
I didn't get to shower like right before our
Yeah.
session. And it's like, oh, well, like yeah, like are you concerned about that? Like kind of asking of like, is this something like kind of where this is coming from? Like if you're worried about if you're like, oh, like I just am recovering from like an infection, like that makes a lot of sense. But are you
Yeah.
generally like always worried about like your like the smell of your junk of your bits? Like then that's something that we can also like talk about and do maybe a little bit of like education or like reframe on depending on where someone's at with that too. Sometimes that's not the vibe, and that's totally okay too.
Absolutely. And education feels like such a pivotal, important part of this work, right? And of course, you're also a sex educator as well as being, a PT and a pelvic PT, especially. And, you have a doctorate as a physiotherapist, right? You've done a lot of studying in this area. And so I had a question and then I lost it because I was like funning out about how awesome you are. And education. Yes, education is such a pivotal area. And it's obviously something you're really passionate about as well because you do educate other providers. So what makes you passionate about educating other providers around working with trans folks specifically when it comes to public health? Because, like we said, pretty much a lot of people, and in fact, sometimes, and that's my experience in sex therapy too, actually, cis folks might have a higher level of shame because they haven't had to do the work that trans and queer folks have had to do around our bodies, including our genitals and how we feel about it and all that good stuff. And so, yes, does that make sense? Like, yeah.
Yes. Yes. Yeah, I just underline.
Mhm.
I really have had the experience of like the folks who have kind of the most like stickiness around like
Mhm.
changing what they have like societal expectations of, especially when it comes to like how bodies like should, in quotes, like work during
Yes.
sex, is tends to be the folks who have not had the experience of like having to really renegotiate societal expectations around like gender and sexuality too. So
Absolutely.
yeah,
Hmm.
totally on that one. And regarding the education for providers on how to like work with trans folks a little bit smoother, I would say that it definitely comes from like my personal experience with like trying to find. I also was in pelvic PT, so I totally get that. And like that was I was really lucky in that I actually had like as an aside, I had a lot of pelvic floor issues growing up that I didn't even realize were
Hmm.
pelvic floor issues until I was actually on a clinical rotation in school for pelvic health. And I
Yeah.
was just kind of like casually complaining to my clinical instructor about something that I was experiencing. And then she was like, wait a second, and kind of asked a couple more questions and was
Yeah.
like, it sounds like you actually could use pelvic PT. And I was like, mind blown. I was like, what are you talking about? And then I was like, oh my God, if I am literally in PT school for pelvic health and I didn't even realize I needed it, like, who knows who needs it? You know what I mean? Like, how does anybody know
Absolutely.
if you don't
Hmm.
know? And then in regards to so as like a little aside, like that felt really kind of important. So I was trying to navigate like being trans and also trying to like enter as I was entering the world of pelvic health. So they always felt like very close together. And it was really hard to like how do I want to say this? There weren't very many people who were doing what I was doing at that point in time, and that
Absolutely.
was really
Hmm.
in the very recent past. Like 2018 is really not that long ago.
Oh,
And
absolutely. Even like 5, 6 years ago, it was like impossible to find somebody doing this work. Yeah. Hmm.
yeah, and it was a very different world. And I had gotten involved with that, like the first or one of the first continuing ed courses for pelvic health providers on treating trans people that had come up because a trans patient who had had a vaginoplasty at a Boston clinic ended up accidentally going to see a pelvic PT when she thought she was going to see a gynecologist. And
Oh.
the pelvic PT was like, wait a second, like I have never seen anybody who's had a vaginoplasty before, but it does sound like you should be here. And then that kind of got back to the surgeons. The surgeons were like, oh my God, wait, we need to know about this too. And then there was a meeting between like the surgeons and the pelvic health providers in the area who we were
Mm.
trying to like figure out like, okay, what do we need to be doing here? And it felt very clear that there was also a lot of pelvic health providers who like really wanted to care for these people, but like just kind of didn't know where to start or what to do. And so that felt very like integral to like the beginning of my career as well. So I was always kind of thinking about like, okay, like how can we get more people to be doing this? Because I had a hard time finding other pelvic health providers, particularly who were trans and who were also like then treating like in this realm. I definitely know
Yeah.
other physical therapists who are trans who they didn't want to do trans health, which is so
Yeah.
fair, or they were just interested in other things. And yeah, I love that when you don't actually have to like when you can separate your
Yeah.
career and identity. I think that can be wonderful, and I love that I don't do that, and I love it all. But I always just like wanted there to be like a million of me or like I should not be like one of the very few people doing what I do. I want there to be like a million people doing what I do. I want to like be able to like refer somebody who reaches out who are like middle of nowhere state somewhere, landlocked state, something like that, or like it's harder to find folks. And I'm honestly like just really hoping that as like things start to like have started to improve a lot
Mm-hmm.
more in the realm of like trans either representation and also just like trans informed care, I feel like there just needs like everyone needs to be trans informed. Like I don't want what I do to be a specialty, you know?
100%. I totally understand that because I remember when, even when I came to Minnesota and I was like, where are the trans MFTs, even as a therapist, or the trans sex therapist?
Totally.
And I'm like, oh, and now I'm like, not only in my practice, but I practice like, I'm like, oh, here's like 20 people that you can go see, that's great.
Hmm.
Like, I want to make myself obsolete and maybe one day I'll even retire, who knows, in like 10, 15 years. But it's like so amazing to see more people in the field, right? And even like the
Yeah.
ASIC Bring Institute, I was like, look at all this amazing, wonderful trans presenters, and we could have had 3 times as many, right? If we had the
Hmm.
budget and time to do a 3-day conference. And it's wonderful. And you are one of the very few like trans pelvic PTs that I know, and actually the only one I know who actually does this work of educating other providers. So if there was 3 things, let's say, that you wanted every physiotherapist or pelvic PT or even just healthcare provider to know about working with like trans, non-binary, gender expansive folks, what would those things be, do you think?
Um,
Just off the top of your head, like.
okay. Okay. My three things would be that there are more similarities and differences.
Mhm.
Um, in any genital arrangement, any pelvis, we have all the same muscles. We just because the external bits might be and also the internal bits organized a slightly different way, but it's the same kind of layout. Um, and another thing that I would really like people to know is that it's not. We need to move past the pronouns. We need to move past the like
Yes.
wanting to learn the DEI kind of component to it, which is important.
Yes.
It's important. Like, please, no, please, dear God, it's 2024. Like, know how to use pronouns. But also, like, the bar is just on the floor. Like, I think that sometimes, like, we get really caught up in wanting to make sure that we're saying the right things. Or I get a lot of questions about, like, what's the difference between, like, non binary and agender and gender queer and all these things, which is, they're important distinctions, of course. And also, that's not what's really making a provider exceptional or inclusive. It's really like being able to like meet someone where they're at, like listening to them, treating
Mhm.
them and their bodies like with respect. And yes, of course, having some like know-how of like, okay, yeah, we might want to be careful of the gendered language. Like, yes, obviously, you do want to use the right pronouns and asking
Yeah.
people how they want to refer to themselves, like all of that kind of stuff. That does require a little bit of training. But after that, like, unless you are entirely specializing in folks who have had gender affirming surgery, when then you do kind of want to know, you want to
Of
take like
course.
maybe some continuing ed on like what's going on there. But otherwise, like the vast majority of trans folks don't get surgery. They never
Yeah.
seek any realm of medical transition. So how can we also support them? And that's not something that you like, yeah, you need to know the difference between pansexual and bisexual to be able to to help out with that. So I'd say like, yeah, it's okay. Like one of the first things I tell people when I'm teaching providers is like take a breath. Like you probably already know what you actually need to know in this situation. I'm just going to give
Hmm.
you some like insights, some tools, and some things to think about. But this is not. You're not going to like learn a whole new realm of like pelvic health just because you're working with trans folks. Even though, yeah, you want to be prepared for the few folks that you might see who, yeah, have had surgery. And I mean, I hope that all trans folks who have surgery in any realm, not just bottom surgery, but in any realm, can go to see a pelvic health provider. That's a huge access problem, but that would be my
Yeah.
dream is that that's true and that it's free also.
That would be amazing.
And
Yes.
it's free and that pelvic health providers are getting paid what they deserve and that yeah
Yes.
it's not on the patients to pay for that, that's to be clear. Yeah, I
Free
think that those are kind
universal
of big.
healthcare. What?
uh,
Like that kind
I
of
know.
revolutionary stuff? I know, I'm with you.
Yeah, yeah, and it's one of those things where it's like, wow, we're really still saying that that's like revolutionary. Just
I know.
access to healthcare, just to be able to not have to like travel like an hour and a half away to see a
Yeah.
provider who isn't going to like treat you disrespectfully. I don't know. Anyways,
Mm-hmm.
but the other thing that I would say is to be comfortable with what you don't know and to be able to say that you don't know things. And
Yeah.
that I think that a big part of being in inclusive and affirming provider is the humility of just like you just got to be humble. And that I think that it's important to encourage folks of any gender that like they know they're the people who know the most about their bodies. Like just because I have
Absolutely.
a degree does not mean that I know more about your body than you do and like your lived experience of it. So building that like trust that somebody has that knowledge already there. We're already doing that work, and so I think that that's just like we're taking it like a little bit further, where we're encouraging people to like feel comfortable with like the fact that they know about how their bodies are working, and then we also want to like turn that back on ourselves of like, okay, yeah, we don't know everything, and that's okay. And I don't actually think that people expect us or our patients expect us to know
Mm-mm.
everything, but to be able to be like, you know what, that's a great question. I don't know. I'm going to look into that for you. Or like, like I'm not totally sure about that component. And we're not asking our patients to teach us things, but we're like, okay, great. Like, is that okay if I kind of follow up about this? Like, is it okay if I, like, I'm just gonna, well, can we pin this one and I can get back to you on this specific thing? And not being like, can you tell me more about this thing that I can Google?
Absolutely. I so resonate with that. The best providers I've seen are the ones who can say, "Oh, I don't know about that," or, my therapist, who I've seen for almost 16 years now, was like, I've never done a letter of support for body modification surgery, and I was like, that is not a problem. We can do this together,
Hmm.
like I've done a lot, but I can't write my own, so here we are. And I'm still seeing that therapist. And same with like medical
Hmm.
providers, the ones who are like, oh, actually, I don't know about this, or let me find out, or let me consult, right, with somebody else who
Yeah.
might not know more about this. I'm like, yes, that's how we do it, right? Like you said, we're not asking our clients or patients to educate us, but to it's so colonial to think that we would know everything. How can we know everything about
Yes.
everybody
Yes.
at all times, right? It's okay. It's a
Hmm.
relationship. So I can be like, let me get back to you about this. I do want to consult with a colleague who maybe knows more about this, or look at what research is out there, because this hasn't come across in my work before. So no, I
Yes.
love that. And talking about educating providers, you're also a kink affirming, right, provider, and I think that's so
Hmm.
important. And as somebody who not only works with kink clients but is part of the community, I think that's another area where people can have a lot of um, what's the word I want to use? Hesitation in kind of disclosing, right? Because there is so much stigma, I think, around kinky practices. And how is kink relevant to pelvic health? I have my own thoughts about it might be relevant, but I would love to hear from you as a pelvic PT. Like, why is it relevant to be open about being kink affirming as a pelvic physiotherapist?
Oh, I love that. I love that question. It is important because if, as a pelvic health provider, if I'm trying to help somebody have more like embodied experiences and I am not like educated or willing to talk about kink, like I might be missing like a whole window of someone's life to be like, okay, yeah, like maybe they, for instance, like maybe they have difficulty with, like they have painful penetration, or painful penetrative sex. And so that's maybe what they're coming in for. And I might be making, if I didn't have this like kind of kink informed background or be part of like a kink community in Boston, that I might make the assumption that that's the only way that someone is engaging
Hmm.
sexually, or that's
Yeah.
like kind of that this is kind of like this is sex for this person. And in
Hmm.
reality, it might just be like a fun thing that they do sometimes, or something that is actually like not part of their regular sexual
Yeah.
practice, and that there could be like other things that they might be doing that might also be like kind of causing some symptoms
Hmm.
or something that might be
Exactly.
impacting their their experience of their bodies, that might be harder to bring up like, oh hey, yeah, like I have these issues like after I like do some like rope bottoming, like I don't know
Yeah.
like if that's like okay to be even bringing up kind of stuff. So yeah, I definitely think it's deeply related, and it's also a huge way in which I think a lot of, especially queer and trans folks, like can like exist in their bodies and like feel like experience pleasure and like just kind of, we're
Mm-hmm.
already moving out of this like cis heteronormative like view of how
Mm-hmm.
our bodies function, and so being able to like lean into like the kink experience of this is, it's huge. Yeah, and so I like to try to tell people like it can be I found it to be like mixed results of just being like, is there anything like kind
Mm-hmm.
of like in like trying to like figure out like how to ask somebody about it, because obviously kink is a huge world, and so like
Absolutely.
how are
It's huge
we
umbrella.
asking
Yeah.
about it?
Mm-hmm.
Yeah,
Yeah.
yeah, and
Mm-hmm.
so I just like to mention as like, oh, like a little about me, and like the beginning of our sessions, it's like I'm a sex educator, like here's some things that I like to that I've taught about, this is what I educate providers on, and so then that kind of can open up the door of like if somebody wants to bring up like a relevant thing, or it's like if there's anything that's causing any discomfort in this realm, or if anything's ever like irritating your pelvis or something along those lines, like kind of like open up the door a little bit more for people to bring it up. But yeah, hugely impactful.
Absolutely. And I find that even folks who might not identify as kinky might engage in some kinky practices. You know, as a sex therapist, I
Totally.
do find like cishet folks who maybe are engaging in like, some restraining with handcuffs, right? Or are like, oh yeah, my partner really likes to, peg me and it's really obsessed with like dilation, and things like that. I'm like, yeah, that's kinky. Right. It's like, and that might have an impact on kind of like on your healthcare, and it can be so
Mm-hmm.
hard, I think, to bring it up to healthcare providers because of that stigma. And so being able to
Yeah.
proactively be like, yeah, I am a kink affirming provider, you can just share anything you want to share and that you think it's relevant, and maybe even something that you don't think it's relevant but might be relevant, right? So that
Yeah.
happens a
Yeah.
lot. Hmm.
Oh, it really does. I tell people all the time that, like my patients, that usually the most relevant statements come after. I don't know how relevant this is,
Yes.
but
Oh my God, all the time. I remember both in pelvic PT, but also with my acupuncturist. I remember being like, this is probably nothing, but this is happening in my body. And they're like, no, no, I want to know. I want, I
mm,
have that kind of hyperinteroception as a neurodivergent person. It can be like either too much interoception or too little. I'm definitely leaning more on the too much sometimes. And so
totally,
I'm like,
totally.
when you do that, like there's this tingling in my like left ear or something, right? And you're like, oh, actually that's connected. Here's how it's connected. And I'm like, my mind is blown every time because I'm like,
Mm-hmm.
this is probably silly. But every time I mention it, a provider is like, nope, that's relevant. So just
Yep.
encouraging your
Totally.
listeners to share the weird stuff. It's okay. Like,
Yeah. Yeah.
mhm.
Yeah.
Yeah.
Absolutely.
And I feel like I could have this conversation for hours and hours, and I also want to be respectful of your time. So, is there anything that we haven't talked about that you were hoping we would cover in our conversation today?
Um, I think this was. I feel like this was like we hit on a lot of the big points of what I do. I'm trying to think. Yeah. I also feel like in the conversation, like it is nice. I like to be able to also like touch on the kink stuff, because I think that
Mhm.
oftentimes it's very like sex ed and trans health focused when I'm
Yeah.
speaking with people in the pelvic health realm. And I even notice like even in that it's it can still be challenging to like bring up the kink topics. And so I love talking about them, and that is something that I also, yeah, I love to like do like I love to educate providers on how to be more kink informed too. And so it's a big deal. So yeah, no, I think you brought up all of the big things.
Yeah, absolutely. I do think it's like people can be so hesitant and providers can be so hesitant in asking questions, or they can make assumptions. Like I remember a
Mm-hmm.
PCP was seeing me for years who it never came up and she never asked. And then I was like, oh, I think we should also do some like STI testing. And she was like, why? And I was like, well, I have a new partner. And she was like, what? And I was like, I'm not monogamous, polyamorous. I've been for like over 20 years. And she was like, oh my God, how did I miss this? Right. And I was like, well, you never asked. was never relevant. She made a lot of assumptions.
Mm-hmm.
But, you
Mm-hmm. Oh
know,
my God.
and
Yeah.
so that
Yeah.
was a great moment, right? Same with kink. And I'm like, yeah, if providers don't ask, people are not necessarily going to volunteer that information if it's not relevant. You know, you have this short time with your provider, you're going through the thing, and then it's not relevant until it's relevant, right? If that makes sense.
Right.
Yeah.
Yep.
And
Yep.
I'm
Exactly.
assuming it's similar for kind of pelvic PT, you know, even knowing what
Mm-hmm.
kind of sex are people having, how are they engaging with their pelvic floor, right? It's probably relevant to the
Mm-hmm.
care you provide your clients, I'm assuming.
Yes, it's definitely relevant. Yeah.
Yeah. Well, like I said, I could have this conversation for hours and hours. I'm sure
Me
there's like
too.
500 tangents in my brain, but I will be kind to your schedule and also to the listeners, because if it was up to me, every episode would be like 5 hours long. So we
I know.
will
I'm like,
not do
I
that.
got nothing to do.
I was like, okay,
It's like, well,
don't, don't tempt me, Alex. Don't tempt me. It's like, you know, we're both Alexes, we're both Italian. We could just keep going and
yeah,
going.
talking forever, hands flying across
Exactly.
the screen.
Exactly. I know. You know.
hmm
Exactly. Yeah. And for you listeners, if you didn't know, the podcast is also on YouTube now. So if you want to watch me talk to my guests, you can do that. But we will be well behaved. And if people want to find out more about your wonderful work, you know, whether they're physiotherapists who want to go into pelvic PT or pelvic PTs themselves, or, you know, potential clients or just folks in general, or like Alex was just like opened up a whole new world of the pelvic world to me, and I want to find out more about their work. How can they find you?
I am currently I'm working on having better like places to find me, but I do have a website. It is under construction, but it's just alexpapale.com. And you can also find me for like PT work. It's going to be at Flourish Physical Therapy. That's where I am. And then I am also on Instagram, so it's Alex Papale PT on Instagram. I am not on Instagram a ton, and I'm like constantly shadow banned, classically. So, so yeah, I don't expect very much coming from that, but that is where you can find me. And I have also recently started a Substack, and so I'm trying the newsletter format. I'm really liking it so far. I need to be more consistent with it. Maybe this will help me do so. But yes, you can definitely find me on there, and it's my Substack is my name again, and it's actually like the name of it is Containers.
Oh, okay. I will find all those links and put them in the episode description so that they're all ready for you, dear listeners. And I so feel you on the consistency. I feel like whatever job we do now, we also have to be social media experts
Mm,
and like post regularly and have email newsletters. It's a lot. It's like a job on top of
it
a job,
is.
but yes.
It is, and then I'm like, all right,
So,
I have to plug like the courses that I have and like stuff like
yes.
this. I'm just like, oh my god, there's so many things.
There are so many things, and the day only has so many hours. So I feel that.
exactly.
Well, thank you so much for making time for this conversation in your, I know what is a busy schedule. I really appreciate it. And dear Gender Stories listeners, I hope you appreciated this conversation as well. And until next time, please take care of your pelvis.